Greetings. My name is Tamika Cook, and my colleague Carnisha Michael are first-year adult and gerontology primary care nurse practitioner students of the School of Nursing MSN program. Today we'll be presenting our sub-role seminar presentation on researcher in informatics from a nurse practitioner's perspective. The purpose of this presentation is to demonstrate knowledge of the sub-role the nurse in advanced practice may encounter or enact in daily practice. In this seminar, we will be addressing responsibilities, authority, and potential legal issues involved in performance of our selected sub-role. Near the end of our presentation, a case study will be presented about a nurse practitioner managing a patient with diabetes using evidence-based research and new informatics and technology. Let's begin. Nurse practitioners are registered professional nurses who are prepared through advanced graduate education and clinical training to provide a range of health services, including the diagnosis and management of common medical conditions. Nurse practitioners emerged in 1960 due to a growing need of healthcare services following World War II. The first nurse practitioner program was founded in 1965 by Loretta Ford and Henry Silver at University of Colorado. Nurse informatics was designed as a nurse specialty in 1992 by the American Nurses Association. Nursing research came about by Florence Nightingale in 1960s. Healthcare is regulated for public good to ensure quality to a public that is powerless to assert quality control as individuals. In the real world, healthcare is regulated for quality reasons to increase access and save money because professional groups lobby for regulation that supports their profession. Regulation is imposed through statutes, regulations, and policies. AR&P practice is defined by the Nurse Practice Acts governed by the Board of Nursing. The present law states that many states require physician collaboration, especially if writing a prescription is involved. Medicare law also states for an NP to have collaborative relationships with a physician. Statutes are defined as laws enacted by state legislature or Congress and is found in state and federal codes. Regulation is a written law by the state or federal agency in accordance with a statute. Policies are defined as rules made by companies or government agencies that do not have the force of law but that dictate day-to-day decisions. A bill is a draft or proposed law presented to Parliament for discussion. Healthcare is regulated for public good. The American Nursing Association states that health information technology enables healthcare providers to capture standardized data and use it to inform patient care and communicate across a range of clinical settings. It is the specialty that integrates nursing science with multiple information management and analytical science to identify, manage, and communicate data, information, knowledge, and wisdom in nursing practice. Clinical research focuses on the care of research participants and the protocols of clinical research and trials. The clinical research nurse balances the needs of the participant and the requirement of research across settings.
Nursing informatics. In nursing, informatics refers to the science and practice that integrates nursing, its information and knowledge, with management of information and communication technologies to promote the health of people, families, and communities worldwide. Informatics is viewed as one of the core competencies of health professional practice, and is often essential for fulfilling other core competencies, including the ability to work in interdisciplinary teams, provide patient care, employ evidence-based practice, and apply quality improvement. Nursing informatics are based on 3 building blocks: data, which is directly observation that don't need interpretation. An example of that would be the patient age, date of birth, or name. Information is data that's interpreted. An example of that would be the number of falls on the unit per month. And knowledge is the identifies relationship that provide further observations to an issue. There are 5 broad areas of informatics. The first one is use of patient care and other technologies to deliver enhanced care, communication technologies to integrate and coordinate care, data management to analyze and improve outcome of care, health information management for evidence-based and health education, and the last one is facilitation and use of electronic health records to improve patient care. Electronic health records collect all of an individual interaction with the healthcare system that will be available to all healthcare providers anywhere in the county. It enhances decision-making process because as a nurse you are able to use your knowledge to gather information from the discrete data and provide further insight to an issue or subject area. Nursing informatics is key to effective decision-making and quality nursing practice. Much of nurses' work involves information. Which involve assessing healthcare needs of patients, developing plan of care, and communicating to other healthcare providers. Before electronic medical records, nurses would have to transcribe orders by hand, which was hard to read and created human errors. Nursing research. Nurse researchers are scientists who study various aspects of health, illness, and healthcare by using evidence-based practice to design and implement scientific studies to develop knowledge to build the scientific foundation for clinical practice, prevent disease and disability, manage and eliminate symptoms caused by an illness, enhance the end of life and palliative care, assure patient safety, and prevent illness and injury. Research helps nurses respond to changes in the healthcare environment, patient population, and government regulations. It also helps nurses determine effective best practice and improve patient care. Research can correct misunderstandings, pave the way for new treatment and protocols, which are all improvement for patient outcome. Nurse researchers identify research questions, designs, conduct scientific studies, collect and analyze data, and report their findings. There are 2 types of evidence-based research: quantitative and qualitative data, and I listed 2 YouTube videos that will briefly describe those two. Quantitative data are used when a researcher is trying to qualify a problem or address the what or how many. Qualitative data describe qualities or characteristics. It is collected using questionnaires, interviews, or observation, and frequently appears in narrative form. Responsibilities of a nurse practitioner depends on their specialty. You can be a clinical nurse specialist who assesses and treats illness in specialty areas of care. They may be skilled in working with specific populations of patients, providing a certain type of care, or treating a certain type of disease. You can be a certified registered nurse anesthetist, which provide anesthesia to patients needing surgical or trauma care. You can be a certified nurse midwife who works with women during the preconception, pregnancy, delivery, and postpartum stages. A regular nurse practitioner who specializes in different areas, such as in acute care, adult gerontology, emergency nurse practitioner, or a family nurse practitioner, to name a few. Overall, the role concept of a nurse practitioner is working directly with patients, family, and in the community to diagnose and manage most common and chronic illness, perform physical examination, order and interpret diagnostic tests, provide counseling, education, and write prescription. You will find many nurse practitioners in the hospital setting, public clinic, doctor's office, private practice, schools, detention centers, prisons, and so forth and so on.
Prescriptive authority is the ability of advanced practice registered nurses to prescribe without limitations. This varies by state. Practice authority includes full practice, reduced practice, and restricted practice. Full practice allows nurse practitioners to evaluate, diagnose, manage treatment, prescribe medications, and control substances under their license without physician collaboration. Reduced practice requires career-long regulated collaborative agreement with another health provider for nurse practitioners to provide patient care. Restricted practice requires career-long supervision, delegation, or team management by another healthcare provider, which is the physician. There are laws and rules that affect nurse practitioners' practice. The scope of NP practice, for example, in some states, nurses can do certain things, and in other states, nurses can't. For example, writing prescription for narcotics with a physician collaboration or without physician collaboration. Reimbursement for healthcare services. Qualifications for NP licensure and renewal. Delegation of authority by physicians. Quality of care. Requirement for collaborations with physicians. Confidentiality and patient privacy. Electronic medical records and e-prescribing. Medical homes and compensations for referrals.
Core competency. The National Organization of Nurse Practitioners Faculties released the first set of core competencies of all nurse practitioners in 1990. There are 9 broad areas of the core competency, and they explicate the unique characteristics and role in adult gerontology population and focus also in acute and primary care. There are 2 videos, two links that have a list of all of the 9 core competencies that briefly explain of those, the characteristic and the curriculum for them. And I will go over a few for you, which is the first one, scientific foundation. It critically analyzes data and evidence for improving advanced nurse practice, interrogates knowledge from humanities and science within the context of nursing science. It also developed new practice approaches of the interrogation of research, theory, and practice knowledge. Leadership. Provide leadership to foster collaboration with multiple stakeholders, which would be the patients, community, or any other healthcare provider to improve healthcare. And also demonstrate leadership that uses critical and reflective thinking. Advocate for improved access, quality, and cost-effective healthcare. Leadership also involves problem solving, business development, and communication. Quality uses best available evidence to continuously improve quality of clinical practice, applies skills and peer review to promote a culture of excellence, evaluates how organizational structures, care process, financing, marketing, and policy decision impact the quality of healthcare. Issues affecting practice include lack of respect towards the nursing profession, lack of understanding of the nurse practitioner role, inability to practice independently, lack of Medicare patient access, and shared savings. All of those are barriers that many nurse practitioners face in today's society, and they all go hand in hand with each other. They're all like a domino effect. Many physicians feel that just because they have a longer and more rigorous training than nurse practitioners are incapable of providing quality, safe care at the same level as them. Because of the educational difference, many physicians thought they provided better quality care to patients compared to nurse practitioners. And although nurse practitioners provided high quality care that improved patient health outcome, it didn't really matter because of the educational difference. And also because of the lack of Medicare shared saving, most nurse practitioners have to bill incident to a physician service, which means the billing of care delivered is under the physician name.
Paul is a 52-year-old self-employed builder who has diabetes. He presents to your clinic complaining that he has been feeling increasingly tired for the last 4 months. His sleep is poor, and he says he can't be bothered to shave in the morning. He says that his previous nurse practitioner was unhappy with his diabetic control, and his wife has now insisted that he sees a new nurse practitioner. Paul smokes around 12 cigarettes a day, mostly at work with his mates. He has hypertension and has been receiving an antihypertensive drug for the past 5 years. He takes an oral statin to lower his cholesterol an oral anti-diabetic drug for his diabetes. He also takes an ACE inhibitor for treatment of hypertension and prevention of diabetes complications, and aspirin for the prevention of cerebrovascular events. Paul does not regularly use alcohol, and he reports drinking a couple of pints maximum if he's out with his mates after a football match. Paul is a 52 you guys are. What are your... On examination, Paul looks overweight and has a BMI of 32. When last seen by the practice nurse, his hemoglobin A1C had increased from 8% to 9.2%, and his cholesterol level is 5.8. His current blood pressure is 145/85. He appears low in mood and is avoiding eye contact and lost his usual jocular manner. He is speaking quietly and describes his mood as fed up. He is blaming himself for not being able to pull himself together. So my question for you guys are, what are your next steps as Paul's new nurse practitioner? Updated evidence-based guidelines by the American Diabetic Association recommends clinicians consider adding a sulfonylurea, a thiazolidine, an SGLT2 inhibitor, or a DPP4 inhibitor to metformin to improve glycemic control when a second oral therapy is considered. In Paul's case, that nurse practitioner probably would recommend adding a second drug of choice to help improve his A1C. Lifestyle changes include exercises and diet. For example, that nurse practitioner can have Paul do carb counting to help control and see how much carbohydrates he's taking in. Also, evidence-based guideline recommends checking postprandial blood glucose because certain medications, either they work on the fasting blood glucose or the postprandial blood glucose. So that'll help the nurse practitioner know what type of medication needs to be added to his treatment regimen. Updated informatics and technology for diabetes include continuous glucose monitoring and insulin pumps. This meets the end of our presentation. I hope you guys found it enjoyable and informative. Our references are listed below. Thank you.